All right, everyone. We're hitting that 5-minute mark, and I think it's a great time to get started. Hope everyone's day is going well. My name is Arturo. I am one of the many staff here at Neighborhood House and part of this call, and I am part of the development team here. Thank you so much for joining us today for part 2 of our mental health series with Leah Post. We hope these virtual events are opportunities to engage, learn about Neighborhood House, our community, and how we can grow together to achieve our vision of a healthy, diverse, and welcoming community free of poverty and racism, where all people thrive. If we can just go to the next slide, please. And yes, thank you. We'd like to remind all of you that this event will be recorded for others to watch that could not make it today. Your camera and mics will be turned off during the presentation until our Q&A time at the end. Everyone is welcome to send us confidential questions through the chat. Please make sure to the drop-down option list Janelle, one of our co-hosts. As you're sending confidential questions, please do not share any personal or confidential or medical information in those questions. We do have Janelle on standby collecting questions again, so we will do our best to get questions answered or combine similar questions for our presenter for Leah today. And if we can go to, yep, there we go, thank you. So I first want to introduce Veritza Jelocic. Veritza, please correct me, and I will keep improving on saying your last name. Thank you. Okay, great. So Veritza is a Neighborhood House staff member who will do the honors of starting us off with our land acknowledgement.
Sure. Neighborhood House recognizes that we are on indigenous lands, specifically the lands of Coast Salish people. We offer acknowledgement to our Coast Salish relatives and cultures, including the Duwamish, the Suquamish, the Snoqualmie, the Makashut, and many other Lashutsит-speaking communities and people. We recognize that we serve communities on lands governed by the 1855 Treaty of Point Elliott, a treaty that has not been fully honored. Neighborhood House also recognizes that we serve Indigenous people who are in King County due to forced relocation from their traditional homelands, and that many of our resources come from sources that we created inequities for Indigenous people.
Do you want me to start, Arturo?
Arturo, you're muted.
Of course.
It was like, I don't
know. The space bar was not on that one. Yeah, I would just like to introduce Leah Post. For many of you who may not know Leah Post joined the Neighborhood House Community Health Management Team in January of 2019. She moved to Seattle from Minneapolis, where she was born and raised. Leah received her undergraduate degree in gender, women, and sexuality studies, her master's in public health, and her master's in social work from the University of Minnesota, Twin Cities. She is an independently licensed clinical social worker who has been providing individual, family, and group mental health therapy since 2016. Leah has been working in nonprofits and advocating for mental health care in underserved communities since 2011. She is passionate about engaging community leaders and providing culturally responsive information, care, and resources. Thank you, Leah, and it is all you.
Thanks, Arturo. Welcome, everybody. I am not sure who all was at the last presentation, but if this is your second time, welcome back. I appreciate you all coming. So today, the last presentation, we went over mental health generally, very, very broadly. And today we're going to try to focus in a little bit more on some cultural considerations, some specific communities that are disproportionately affected by mental health and don't get the same level of mental health care. And then we're going to talk a lot about resources today. And I will do my best to answer questions about specific resources in Seattle, with the caveat that I have only been here for 2.5 years. So many of you may know more resources than I do, but I also am happy to do the research for you and am happy to find some things that may work. So also, Janelle just put in the chat, feel free to ask questions if you have them to her directly, and we will leave time at the end for that. Okay, so I wanted to review what we're talking about when we say mental health. It can mean different things to different people, but I wanted to focus on what we're talking about today. So mental health is a state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to their community. It is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. And so while, this is a very, again, broad definition, mental health may look different in different communities and to different people. The goal is that you're in a space personally where you feel well, that you're being productive, that you can do what you want to do, that you're able to get through your day without significant problems or concerns. And so that's really kind of where we're focusing on mental health. So we're going to dive right into a bunch of data. And I apologize for all of the words on the screen, but there's a lot happening in the world of mental health. I also will say that we don't always have the most up-to-date information because it usually takes at least a year for stuff to get published. So this is kind of like late 2019, early 2020 data. The most recent stuff is a little bit behind. So nationally, so out of 50 states plus Washington, D.C., so out of 51, Washington ranks 28th on access to mental health care. What that means is that we're kind of middle of the pack, that we're not the worst, but we're definitely not the best on having access to mental health care. We're going to talk a little bit more about why some of that may be, but I just wanted, to get a sense for where we stand in Washington, with the rest of the country. 46% of Americans will meet the criteria for a diagnosable mental health condition sometime in their life. And half of those people will develop conditions by the age of 14. So in the last presentation, we really talked about how common mental health conditions are. And as you can see here, about half of all Americans, and this means for adults, most people will experience some sort of mental health need in their lifetime. Many people will experience it at a younger age, but it doesn't mean that if it doesn't happen young, it's not going to happen. So I just want to remind everybody how common mental health is, and that's why one of the reasons that we're doing this is to just start talking about it. So as we all know, COVID has had a huge impact on a lot of people for a lot of reasons. But even before COVID, the prevalence of mental health illness among adults was increasing. And since COVID, it has continued to increase. And there is a huge shortage of mental health providers right now because there are more people that are seeking treatment than there is treatment available. Something, again, we're going to be talking more about, but I just want to make sure everybody is aware that COVID absolutely has had an impact. So in the past, we didn't really talk about any specific disorders, but the major disorders that we usually see, at least in the United States, would be major depression, anxiety, alcohol use disorders, schizophrenia, bipolar disorder, and dysthymia. Dysthymia is a more moderate depression, and these were identified as some of the leading causes of disability in the US. Mental health is absolutely something that can cause physical disability as well as a mental disability. The impacts of mental health on our day-to-day lives can really, really become problematic if not treated, or if someone's not aware of what's going on. Currently, and again, this data is about a year old, but about 44 million US adults have mental illness. and currently 9.8 million US adults experience suicidal thoughts. And so it is something that happens a lot. It is something that is really common. Many of you probably know either personal friends or family or acquaintances that have experienced some kind of mental health concern or condition. And so we're just trying to normalize the conversations and normalize some of the care. Globally, mental health affects more females than males. And I will say with the caveat that these studies are pretty binary, meaning that they are looking a lot at just men and women and don't take into account folks who identify outside of that. We are going to talk more about that later in the presentation, but this is just how the data is written. In the world, anxiety is the most common mental illness. So again, oh, okay, sorry, I thought I muted myself. And again, this is reported. So we know that a lot of people may not talk about it. They may not go see a provider about it. They may not know that what they're experiencing is anxiety. And so this is the data that we have. But anxiety affects approximately 284 million people every year. The mortality rate for people with mental disorders is significantly higher than the general population, with a median life expectancy loss of 10 years. So what that means is there is, in the United States, there is a life expectancy number. I don't actually know what it is off the top of my head. I think it's in the 70s, maybe. But there's a life expectancy for people that are generally healthy and how long they can generally live a healthy life. What this means is that if someone does experience a mental illness and it's prolonged, that there is a chance that their life expectancy could be up to 10 years less than someone who is not experiencing a mental illness. So it definitely has a very large impact. And then mental disorders are attributable to 14% of all deaths worldwide every year. So that's about 8 million deaths that are associated with mental health. And that's not necessarily just people who die by suicide. It can also be many other factors, but 14% of all deaths are attributed to mental health. And so it's definitely something that we want to bring more awareness to and talk more and normalize treatment. So that's why we're here. But if anyone has any questions about these, please put them in the chat and we can talk more about them. So I really want to talk more about cultural considerations. I do want to say up front that I am a white person, and so I do not have the experiences and will never have experiences that individuals of color may have. What I do know is that there are differences. So the United States in general has very significant histories of systemic racism, not only in mental health care systems, but in all medical systems. What that means is that oftentimes people of color experience very different things than white people who may be going in for the exact same issue or problem. And so I do want to acknowledge that. I want us to know that this is something that is still happening today. And it absolutely plays out in our mental health care system too. So compared with people who are white, BIPOC, which stands for Black, Indigenous, People of Color, BIPOC individuals are less likely to have access to mental health services. They're less likely to seek out services. They're less likely to receive needed care. They're more likely to receive poor quality of care, and they're more likely to end services prematurely. Now, all of these things may be different for some people, and one of the biggest things is that a lot of the providers are white. So the last bullet on this page, if you look, 86% of all mental health providers in the United States are white. And that is not the same as the population in general. So the providers does not match the population. So an example of this, Black men are 4 times more likely to be overdiagnosed with schizophrenia, but underdiagnosed for PTSD or other mood disorders. So there, I talked about it last time as well, but there's one book that we all as providers have to use to provide official diagnoses in the medical world for mental health. It's called the DSM-5. And that book it has a lot of authors, but the vast majority of the authors are white. They are older individuals, and they are people that don't have the lived experiences. And so what may be perceived by a white person as certain symptoms is not actually what's happening. And so misdiagnosis is very, very common, and it shouldn't be, but it is something that happens more frequently for BIPOC individuals than it would for a white person, because the books are written based on symptoms they've seen in white people, not based on symptoms they've seen in people of color. And that's a really good example of systemic racism at play. But I just like to remind folks that it is something that happens, and it's still happening today. So we're going to talk a little bit about it. I don't want to get too far into the weeds on it because I want to make sure we get through all the material today. But again, if people have questions, please let me know. Sorry, the one on the left is a little fuzzy, but you should still be able to read it. So if you're looking at who uses mental health services, this is compared to white people. Here they describe it as white European Americans. You can see that African Americans and Hispanic or Latino identified individuals are more than 20% less likely to use mental health services or seek them out. And Asian Americans are more than 51% less likely. So they're half as likely as a white person to seek out treatment for mental health. Also on the right-hand side, and this one is more difficult as someone, I'm a provider myself. So of white healthcare providers, so these are people that are white, 51% believe that their patients do not adhere to medical treatments as a result of cultural or linguistic barriers. That could be true, but it's more likely true that there could be mistrust, misunderstanding. They may not have used interpretation services. It might not be something that fits within their cultural belief systems. So a lot of the times healthcare comes from a white Caucasian framework and doesn't leave a lot of room for interpretation. And that's something that us as mental health providers and in general as healthcare providers need to work on. 56% of healthcare providers, of white healthcare providers, report having no form of cultural competency training. I'm not a huge fan of the word cultural competency. I like to say awareness or cultural consideration. I don't think it's possible to be competent in any culture other than your own, but we still need to respect them. And we still need to understand that maybe a treatment won't work or won't be as effective if someone has a belief system that goes against it. And so we really want to be cautious and careful and respectful of everyone's needs. And sometimes a white healthcare provider may not be the right provider for somebody. And so that's something that we need to talk about too, and normalize that you get to pick your provider. Unfortunately, a lot of the time, maybe your insurance doesn't allow for that. But if they do, it is something that can be done. You can shop around for, especially a mental health care provider. You do not have to go with like the first person that you meet. So it's okay to ask for what you need in mental health care. So again, more data, but I like to talk about it to make sure that we all know what everything is showing. So prevalence is not necessarily higher among racial and ethnic minority groups, but individuals in these groups are less likely to receive treatment services. And if they do receive treatment services, those services are going to be less culturally appropriate. So in the slides before, we showed that people of color are less likely to reach out for services. It doesn't necessarily mean that they have more mental health needs or that their mental health needs are higher. It's that they don't feel that they have access or they don't feel that they can find appropriate care for them. And that is absolutely a huge barrier. Ethnic and racial minorities often bear a disproportionately high burden of disability resulting from mental disorders. So while, again, it might not be more common, or people within the communities of color may not have higher levels or higher rates of mental health, because they aren't accessing treatment, the impacts of their mental health are going to cause longer term problems, meaning that they may have disability related from it, and those disabilities may last longer. Another example of this, so the rates of depression have been shown to be lower for Black and Hispanic adults. However, the depression seems to be more persistent, meaning that it's going to last longer. Again, all of this ties back to maybe lack of access to care, lack of consistent care, lack of culturally appropriate care. And then Asian Americans are less likely than any other racial or ethnic group to use mental health services, like we saw in a previous slide. And again, most providers are white, and so it's hard to find someone that could understand. There may also be huge stigmas in communities that we don't know about. People might not have enough money. They might not have good health insurance. They might not have health insurance that covers mental health. So it's there's a lot of reasons that someone might not seek care. And then among all racial and ethnic groups, women are more likely to receive mental health services than men. And that's across the board. And we see that in almost any type of community, that women are more likely to receive mental health services. I think that is a very stigmatized thing. Mental health is stigmatized in general, but it may be more stigmatized for cisgender men, because it's seen as like quote unquote a weakness or something. So that is something that we see as well. So I don't want to talk about mental health without acknowledging that a lot of things can tie into it. So there's a concept called social determinants of health, and social determinants of health are things that everyone needs to thrive. And so mental health is one of them, but physical health, basic needs such as a place to sleep, access to food and water, access to education, access to community, whether that be a religious community, a cultural community, friends, family, whatever it may be. All of those things play into someone's total health, and mental health is just one of those. So kind of a few more statistics. I'm sorry that we're so statistic heavy, but only 1 in 3 African Americans who need mental health care receive it. We've talked a lot about why that might be, but Asian American women aged 65 or older have the highest rates of suicide in the country compared to women of different ethnicities. American Indian and Alaska Native individuals experience rates of serious psychological distress, 1.5 times greater than the general population. And then several studies have found that bilingual patients, so people who English may not be their first language, they are evaluated differently when interviewed in English instead of their first language, meaning that if there's not an interpreter present, that interview may look different than it would be to a native English speaker. And that's a big problem, because it might be reviewing different things, or the provider might use different words than they would with a native English speaker, and then they may not be getting the right picture, or might not be understanding people as well. And so all of these things play a huge role as to why individuals may not be receiving care. All right, so I want to shift to the LGBTQ plus population, and I don't want to take away anything from individuals that hold multiple identities. And so if a person is a person of color and identifies within the LGBTQ community, these statistics are for everybody. So 4.5% of the US population identifies as lesbian, gay, or bisexual. Over 39% of those individuals have reported having a mental illness in the past year. And that equates to 5.8 million people. And this graphic shows that that's more than the entire state of Kentucky. So 5.8 million people is a lot. 4.5% might sound like a low percentage, but that translates into a large population of individuals. So some of the things that might impact someone who identifies as LGBTQ plus from receiving care or may have an impact on their mental health. Personal, family, and social acceptance of sexual orientation and gender identity affects not only mental health, but also the personal safety of LGBTQ plus individuals. 48% of transgender adults report that they have considered suicide in the last year, compared to 4% of the US population. That's a huge number difference. So half of people who identify as transgender have considered suicide, compared to 4% of the general adult population. That's a big number. 8% of LGBTQ plus individuals and 27% of transgender individuals report being denied needed healthcare. So this is both healthcare and mental health care. And denial of care can come for a lot of reasons. It can come from personal provider bias. So a provider may refuse to see somebody because of their identity. It may come from insurance denying that care to an individual because of their identity. And it may come from, like, if someone is younger, it may come from their family or friends denying them health insurance, access to health insurance because of their identity. LGBTQ plus adults are 56% more likely to develop an alcohol use disorder and 3 times more likely to develop any other substance use disorder than the general population. And I think some people separate out substance use and mental health, and while they are different things, they absolutely impact each other. And so I don't want to discount anyone that also is experiencing some sort of substance use disorder. It has a huge impact on someone's life, and treatment is also difficult to find. So this is re-talking about social determinants of health. So as we've pointed out, for people of color, for individuals who identify as LGBTQ+, there's a lot more that goes into their mental health than just one thing. It's really, really hard for an individual to care about their mental health if they don't have a place to sleep at night, or if they're always wondering where their next meal is coming from. And so it's really important for not only us as individuals, but also providers to take into account the big picture of someone's life. So I mentioned a few of these things, but all of this has an impact on someone's mental health care and healthcare. So childhood experiences, what we go through as a kid absolutely has an impact on us. And tied in with that is biology. So some people are just predisposed to more mental health concerns than others, but it's something that definitely needs to be taken into account. Housing is a huge one. Again, if someone doesn't have a place to sleep, or if their housing is unstable, if they're at risk of getting evicted, this absolutely has an impact on their mental health and may take up a lot of brain space if it's something they're always worrying about. Access to education. Education is something that, you know, in the US you get through grade 12, but there's a lot of reasons that people may not be able to finish that or may not have access to that. And so education is very important. Social support, like I mentioned, and then community-based, that can be from a lot of different places, but having people who you know support you is very, very important. Income of any kind. So if someone does not have income, it's hard to maintain housing, it's hard to maintain food, all those things. Access to employment, and that could be a lot of things. So some people, you know, can only do certain jobs or have certain jobs, but having access to being able to work can often be really important. And then, of course, access to health services. So not only mental health care, but also physical health care. And as many people know, we do not have healthcare for everyone in this country. And so if people don't have insurance, or if someone is undocumented and can't access like funding for healthcare, it's going to be very difficult to address needs that they have. And as we've mentioned, mental health can be very debilitating and can cause disability for individuals. And having a disability can also impact a lot of other things on this list, including employment, education, housing. So again, we are very complex people, all of us are. And so it's really important to take into account all of these things when thinking about why someone might not want to access care, why they can't access care, why they're hesitant to access care. All of these things tie into that. So we ended a little bit early, which is totally fine, but this leaves room for lots of questions. So if anyone has anything that they would like to ask me privately, please feel free to send me an email. Just a reminder, please don't share like personal medical information with me, but also I cannot provide diagnoses to anybody. I'm happy to, talk through some things, but I can't provide any specifics. I did send a list of resources to Janelle, and so we can put those, these are some of them, and then we also have a lot larger list specifically for the BIPOC community in King County, and then specifically for LGBTQ individuals, both in King County and nationwide, because it is really important to access care in a place that feels safe. So any questions, or Janelle, I didn't know if anything came up.
Yeah, there were a couple. One is that somebody messaged me to say that they work with a great Asian American mental health counselor in Seattle, and they are willing to share the contact information if anybody's interested.
Yeah, girls, everybody, I mean, if you have a great provider, let us know, because it's important to know as well.
Yeah, the good ones are like gold, I think. And someone else said the info in these slides is very powerful and useful. Will you be sharing the slide deck? So we will be sharing the slide deck that will be sent in an email after the event. And Arturo will also be placing the recording of this on our website.
Great. So, oh, I see. Oh, I got a question. Are there any things you would say specific to BIPOC and prenatal? Age 5, particularly about relational health, parent and child. If this is about like how to prepare for talking about mental health, or if this is more about like resources for those individuals. There are a lot of resources for younger children. Unfortunately, in general, there's a lack of BIPOC providers. And I think, especially in child mental health, so I personally don't provide treatment to young kids. It's more of a specialty. And I think a lot of people, there's an even greater disparity there for providers of color. So, but as far as like resources for healthy mental health for young individuals, oh, sorry, I'm just reading more about considerations for this age range. Yes. Yeah, so there's a lot of considerations. I think if we think about social determinants of health, I always kind of go back to that. How can we support people in a way that is culturally appropriate, is something that feels good to everybody involved? So it's important to have parents involved or caregivers involved. And just like sort of this whole discussion is about, it's really important to just talk about mental health. And so one of the things, especially with kids, is to encourage them to talk about their feelings. I think what happens a lot, and what I've seen in some of the folks that I've worked with that do work with kids, is that there's this idea, especially for kids of color, that any type of acting out as seen from like the white perspective is considered a disorder. And so I know that young kids of color often get diagnosed with, now I'm not gonna remember the name, but it's essentially like a disorder where they're like acting out all the time. And that's disproportionately given to young kids of color, especially young Black boys. They're often given that diagnosis, when a lot of the times it is something that is normal and okay within their society, and or not society, I'm sorry, within their culture, within their families. And people express things differently in different communities, and I think that's not seen all the time. So letting kids talk about their feelings, expressing them, talking about them in a safe way can be really, really important. And there's lots of really great online resources for that. I can look them up and send them. But yes, it's very unfortunately disproportionate for young kids of color that they are seen as like misbehaving, whereas like a white child with those same behaviors may be seen as like, oh, we should, they're just expressing themselves, or we should take them in, or something like that. It's very different. I don't know if I explained that well. If not, feel free to message me again.
Well, Leah, how would we go about making seeking help for and talking about mental health subjects more of a norm in our society?
How? Well, coming to these is, a good first step. It's hard because we don't necessarily want to ask individuals like, how's your mental health? How are you doing today? But that's also a good place to start, just creating a safe space for those conversations to happen. I think another thing that we have to do is to make it uncomfortable, because if the reason it's uncomfortable right now is because we make it uncomfortable. And so talk about it, push through it. Don't let it be something that's not talked about. That's a really great way to kind of push forward. It's just so important to bring things to the surface. When it's uncomfortable, I think that's when the most change needs to happen. So if something feels uncomfortable, maybe think about why that is for you individually, and then what you can do to make yourself feel better about talking about it, and then also to encourage others in your life to do the same. I also, I wish that schools would talk about it more with young kids. I wish that this was something that was more regularly assessed during just like general checkups. I know that it is becoming more normal, but especially for younger kids, they don't always, look at mental health. Or if they do, again, we have the problems of like misdiagnosis. So just talk about it. Go to events. You can, volunteer with things. You can, I don't know, join Facebook groups. There's lots of options. And then, if you are someone that likes to donate or get involved in other community events, there's lots of like nonprofits that do work specifically with mental health. So Neighborhood House, we don't provide mental health care, but we work with a lot of people that do. And so providing resources for individuals who may not be able to afford care can be a really powerful way as well.
Leah, Washington is in the 28th rank in mental health services. How can we improve our services? What are some of the top reasons that other states are ranked higher? And thank you for this presentation.
Yeah, so there's a lot of things. I think a big one is federal funding or state funding. So every state in their budget has the option to provide more money and resources to community-based clinics that provide mental health services. And then within that, so the state has their budget, and then each county has their budget, and sometimes each city does. So it kind of starts big and then filters down. So while Washington State last year, when they put out their budget, they increased the budget for mental health care, King County decreased theirs by $2 million. And so this is something that is always challenging, because we know that if we have more for mental health care, what did it get taken away from? And so there's always that kind of balance of where does the money come from. But one of the bigger things too is that mental health can be healthy if we prevent it. So, or if we have prevention techniques in place to provide more positive mental health experiences for people. And so a lot of that comes way earlier on, especially with young kids, especially with school. And so providing mental health care, creating spaces where mental health is talked about and encouraged can actually be really beneficial. Washington in general is, I mean, it's a big state, and as many of you know, the resources from like King County to Eastern Washington are going to be vastly different. So we may be 28th. I think first was Massachusetts. And so I think it has a lot to do with funding, but it also has a lot to do with what kind of clinics come into the spaces, what kind of providers. It has a lot to do with licensing. So like, for example, I was trained in Minnesota, and it's actually harder to get your mental health license in Minnesota than it was in Washington. I don't know why that is, but each state has different licensing rules, and my license can't go over state lines either. So I dropped my license in Minnesota to come work here in Washington. But that can also have a big impact as number of providers. If there's not enough people, then there's just no resources. So there's a lot of things that tie into that. And what can we do? People can vote on lots of, like, a lot of these things may be by public vote. So sometimes if you see certain things on your ballot that might have to do with mental health, make sure you're educated about what they mean. You can lobby for it. You can also talk to your local communities. So I know that a lot of local community leaders can have a big impact on the mental health care. So if they're proponents of it, it's going to be something that's much easier to push through. People are going to want to allocate resources. A lot of people want to see results, right? So showing that mental health care in the community is a positive thing can be really important as well. So there's lots of things we can do, but sometimes it has to do with money, just straight up. So
Leah, I have a couple more questions for you.
Absolutely.
One is, how does a mental health provider balance the Western medical secular approach with beliefs common in other cultures? For example, the Western provider may believe that a person has schizophrenia, whereas this person, coming from a different culture, may believe that they are a messenger of God or possessed by evil spirits, and that their visions are a special blessing or a curse. They may refuse counseling or medication. How do you provide effective treatment while acknowledging these beliefs?
It's a good question. It's also a very complex answer. I mentioned before that at least in the United States, we have one book that we can use to diagnose people. And so if a person is in a Western treatment center, they will get whatever diagnosis comes out of that book, right? And part of the problem with that is, one, it may not take into account their community, but also insurance won't pay for it unless you get a diagnosis out of that book. And so it's kind of this complicated thing. And so there are a lot of providers that I know that will say to somebody, we need to provide a diagnosis to your insurance company. I want you to be comfortable with it, and then we can do treatment together in a way that feels good to you. And so sometimes that schizophrenia diagnosis may be just that. I can't speak for everybody, but it may be the way in to receive care and get care paid for. That being said, one of the things that we as mental health care providers and any healthcare provider is safety of individuals. And so for me, if I'm working with someone that may be experiencing those types of feelings and experiences, my biggest thing would be if they can maintain their own safety and the safety of others, then I think the work is more around what does this mean to that person? How is it impacting their life? Is it positive? Is it negative? And so one of the biggest things that, and I can only speak for myself, but is to really take a step back, because I am not the expert in a person's life. They are. And so that is the type of care that I personally seek out. And then it's the type of care that I like to provide. There is definitely shifts happening in the mental health community about trainings. that are more appropriate and understanding different communities. And we're also trying to get individuals who have lived experiences to be providers. And so there's not one right answer, but I think in general, there are a lot of ways that someone could work with an individual like described, and not, it wouldn't be about judgment. It would be about like, what does this mean to you? And also why are they seeking services? So that's a really important question too. I don't know if I answered that. That felt long. If not, please feel free to ask again.
Yeah, if there are any follow-up questions, let me know. This next one is, I think, a really good one, Leah. I mean, they've all been great, but what is your team or neighborhood house in general doing to support
mental health? Oh, I was like, support what? Yes, so my team specifically, we are fortunate to have some funding from SAMHSA, which is a federal agency. It stands for Substance Abuse and Mental Health Service Administration. So SAMHSA gives us funding to help cover the cost of mental health services for individuals who could otherwise not afford it. Now, of course, we can't help everybody, or we definitely would, but we focus on adults, specifically folks who are undocumented, or folks who have private insurance with huge deductibles, like $3,000 or $4,000. Because a lot of times in 1 year, that might be the cost of your mental health services, but that's a huge out-of-pocket cost. And so this year alone, we've already paid for over $200,000 in services for individuals. And each year our money renews. And so that's what my team specifically does. And all of my case managers, we have access to the resources for individuals. We've also found that some people aren't as comfortable with some of the more like quote unquote mainstream mental health providers. So there's a lot of community mental health providers, but not everybody has a good experience. And so part of my team's role too is to make sure that a person feels comfortable and safe where they're at. And so that's right now where Neighborhood House is at. We, like I said, we don't provide direct mental health care here at Neighborhood House, but we do provide referrals, and we can also help cover the cost for some folks depending on their situation. And those are grants that we try to renew as often as possible, and are always going to be fighting for. Oh, you're muted, Janelle.
Sorry, my dog was barking.
That's okay.
I don't have any other questions in the chat at this time. I don't know if anybody has any in theirs.
I wanted to go back. I just thought of the diagnosis from the question about young kids. It's called Oppositional Defiant disorder. That is the diagnosis that's often given to especially young Black boys, and it was only added in the last version of the DSM. It was not there before. And so it's ODD is often how it's referred to, and oppositional defiant disorder, if you read the description in the DSM, is basically like a kid who's just having a bad day. And that's a really hard thing, but unfortunately, it's a way that many people use to not only stigmatize mental health, but also oppress communities of color or oppress certain communities because it's easier. It's easy to say that person has a mental health disorder because mental health is stigmatized. And they might have a mental health disorder, but a lot of times people just give that diagnosis because it's easier than actually sitting down with somebody and learning about their life and learning about like how they express behavior or what's been expressed in their life, what's appropriate in their community, what might not be. So I just wanted to go back to that because it just popped in my head. So, but I appreciate everybody so much. If you have further questions, please don't hesitate to reach out to me. My email was in one of the slides, but I think it'll also be probably in the follow-up email as well. And thanks everybody. It was so great. I received really great feedback from the first one, and I appreciate you all coming. Just you being here is a great way to start the conversations about mental health care, especially for the communities that Neighborhood House serves and for individuals in your life.
Thank you so much, Leah, for doing this for the month and having these 2 sessions and helping us normalize this topic of mental health in our communities and keep advocating for it. A lot of information to digest, and I'm glad we're going to have these. We will have these available as recordings. I'll make sure to send an email with the slides to everyone, the resources listed in the chat, and we'll add them, and contact information. Everyone's welcome to reach out to Leah. She's sharing her contact with us, which we really appreciate. We will continue to have more of these conversations and these presentations available to our community. So we hope people take the time to learn and want to advocate and stand with us and become stronger advocates in our communities. Look out for those emails in the near future. But thank you so much today for joining us, and have a great Wednesday.